Texas Oncology is a multi-specialty organization made up of over 400 physicians, and we actually treat the most cancer patients in the state of Texas.
I think about every day, from the moment I wake up until the moment I go to bed, how do you improve the quality of care for patients in their communities?
I think if you were to go back in time 10, 15, 20 years, the focus was simply on do the chemotherapy with the few medicines we have available, do the radiation therapy, and basically come back in 6 months and we'll do a follow-up examination. And nowadays we look at it as much more of a big picture.
We identify survivorship and the issues around survivorship on day one. So when you come in to learn about your chemotherapy, you come in to learn about your radiation treatment or your potential surgical intervention, physicians are already thinking about the issues surrounding survivorship, and we try to touch on as many of those as possible at the beginning.
My goal is that, we get you through this thing that may be the hardest thing so far you've faced in your life, to the other side of it, where you can focus on your health and your exercise and your family and have children and get married. And that's really Texas Oncology's focus on survivorship, because we need to support patients as they survive cancer, as thankfully so many more do, to make sure that they're healthy during those periods.
There's the physical aspects of surviving cancer, and then the emotional aspects. Once their life has slowed down and they don't have 100 appointments to go to, they really start to reflect on what's happened to them in a way that they probably never really have had to think about before.
I think attending events like the Texas Oncology Survive and Thrive Symposium do much more than you would imagine. They allow patients to encounter other survivors and other people with hope, with energy, with heart, and help them regain that energy and move through all these tests and all these follow-up visits and move on with their life. I think that people feed on each other. The positive attitudes feed on each other and enhance everyone's lives.
People here today have all kinds of diagnoses, and their family members are here and their caregivers, and just that little bit of support out there in the community is going to be really important for those people.
Patients attend these symposiums, and then they bring it back to their support group, and they bring it back to post on their blog, and they begin to talk about these things, and that's really healthy because it provides education, because it provides a community, because we need to be engaged in this discourse.
For me, the goal of a Survive and Thrive Symposium is to celebrate survivors, honor our survivors, create a better survivorship community, and also to empower our survivors to be the healthiest they can be.
When I see people back in clinic 5 years later, 10 years later after the completion of their treatment and they're cured, and I see them with their spouses, with their children, and that they've moved on with life, that is the success. That is the measure of success to me.